This is not COVID, Jake, and we don't want to treat it like COVID. We don't want to cause a public panic over this. We want to treat it with the hantavirus protocols that we're successful in containing outbreaks in the past. The key message I want to send to your audience is that this is not COVID. This is not going to lead to the kind of outbreak.
The hantavirus outbreak on a cruise ship is bringing back memories of COVID, but health officials are confident this isn't the start of another pandemic. Hello, everyone. Welcome to the final hour of the big weekend show. So that cruise ship where the hantavirus broke out has docked at Spain's Canary Islands. Several Americans are now returning home via a charter flight from the U.S. State Department. CB Cotton is live with more details. CB?
Hey, Tommy. So 17 Americans and one British national are now on a State Department charter flight headed back for the United States. According to health officials, they're on the ground in the Canary Islands, where the hantavirus-stricken cruise ship MV Hondius is currently docked. So as of this afternoon, Spain's health minister said 94 of the ship's roughly 150 passengers are now off the ship. Video captured some of the first evacuations, showing people wearing personal protective equipment from head to toe. Small boats took these passengers to the shore, where Spanish officials said a strict process kept the evacuees away from the public. Health officials said none of the passengers were showing symptoms of the flu-like hantavirus, but the French Prime Minister said one of France's repatriated citizens developed symptoms on a flight home. The CDC said it sent response teams to screen the passengers returning to the States, who are now en route to the Air Force Base in Omaha, Nebraska. From there, they'll be taken to the National Quarantine Unit at the University of Nebraska. ABC News reports from a CDC official that staying at that facility will be voluntary, and that the returned Americans may choose to go home and watch for any potential symptoms while staying in touch with state or local health departments. So we've repeatedly asked the CDC for clarity on exactly what options Americans will have once they land back in the U.S. So far, those questions have gone unanswered, but a World Health Organization official told Fox News that this process would be in line with their recommendations.
Our recommendations are that everyone who goes back to their home country is followed up with active follow-up for 42 days. This would include checks, health checks by authorities, and either be quarantined at home or quarantined in a medical facility.
So global health leaders have repeatedly said this is not another global pandemic because the Andes strain of this virus cannot easily spread between people. Repatriation flights are expected to continue through tomorrow. Tommy.
CB Cotton, thank you so much. And joining us now is senior scholar at the Johns Hopkins Center for Health Security and Infectious Disease, physician Dr. Amesh Adalja. Doc, you know, a lot of us are not loving the news of this for many reasons, but it harkens back to the tyrannical days of COVID, and we're like, we don't want to do this show in boxes again. But, you know, the CDC or others in the field have repeatedly said, hey, this is not like COVID, this is not like coronavirus, don't freak out. What do we need to know at this point, and what should Americans brace themselves for as these passengers come off the ship, as they go to Nebraska, and they have the choice whether to go home or not?
The first thing is to recognize that different pathogens, COVID, hantavirus, influenza, measles, whatever it might be, they all have different transmission characteristics. So even though any of them can cause a public health emergency, there's a different caliber to them. So when you're talking about the Andes version of hantavirus, yes, it can spread from person to person, but it's really constrained in doing so. So it doesn't pose an epidemic or a pandemic threat. Only certain things can actually cause a pandemic, namely respiratory viruses. And I think that this plan of bringing these passengers home, checking them in Nebraska, and then letting them do home quarantine with follow-up with local and state health department officials, that's a legitimate and rational way to go about it. And we did this for Ebola doctors that had come back to the United States after the outbreak in 2014, and that went off really well, even though that's even a more high consequence disease. So this isn't something that the general public needs to worry about. Things are happening the way they should, and the virus is behaving exactly as we would predict it to behave.
Doctor, I appreciate you saying that. Sounds like there's a veil of common sense getting thrown over a lot of fear, but that fear is warranted. I mean, we did go through 2020, and for 100 years almost, we hadn't seen anything like that until then. Looking for something positive on the back end of COVID, have we, are there advancements and techniques and things that we've learned through COVID that help in these situations?
I definitely think they learned a lot about communication and being nuanced and being able to deal with uncertainty. The WHO, I think, has handled this very well. Obviously, science has progressed. We know how to use PCR tests more easily. We know how to develop vaccines quickly if necessary. So there has been scientific advancements, but I think we're also in this era where when there is any kind of infectious disease emergency, everything is looked at through the lens of COVID, and not everything is COVID, and all of that gets bundled together. So people think that anytime anybody's concerned about an infectious disease, that means you're going to the bad old days of COVID, and that's kind of a false alternative.
Doctor, I think part of the reason why people might be concerned, it's not just the COVID thing. Yes, this disease is far less transmissible than COVID, but it is much, much, much deadlier than COVID if you do, in fact, contract it. So people might be worried about that for obvious reasons. We did hear in the clip that we played from Dr. Bhattacharya talking about previous outbreaks and the containment protocols working well with this disease. I wonder if you can address both of those points.
So the Andes virus is one that transmits from person to person, and there had been an outbreak in Argentina that was stopped once they kind of removed the infected individuals and used social distancing in that specific outbreak. That's not something that I think will happen at a large scale because this doesn't transmit through a population. This was a birthday party that got infected in Argentina. The other thing is back several years ago, someone with Andes virus appeared in the United States in Delaware, and they diagnosed that person in Delaware, and they did contact tracing, looked at all of our contacts, and no secondary infections occurred. So we know how to handle this virus. I think it's just important that public health authorities are resourced enough to be able to do it, but I don't think that this poses a risk to spread in the general population. Even though it's a deadly virus, it is really, really limited in its ability to infect people.
All right, doctor, thank you for that. I have a question about just the way the CDC has been communicating. The leader of the WHO went physically on the ground, gave a lot of information, thanked the general population. We're seeing these, a little bit dramatic video of people, dressed in the suits, getting people off. For the French prime minister gave actual numbers that there were 5 French citizens that arrived on Sunday, that one of them developed symptoms during the flight. Very specific stuff. But when we reach out to our own CDC, even the State Department, we're not getting a whole lot of specifics. It doesn't seem like this would violate HIPAA or anything, and yet there's a lot of concern. Should we be getting more information from the CDC?
Definitely. I do think the CDC should be taking a proactive stance. They should have been doing it earlier on. It's good that they sent CDC officials to the Canary Islands, and it's good that we're hearing from the CDC, but what you want is communication constantly, even if this doesn't pose a threat. The CDC was the best public health agency in the world. So you want their experts to be engaged, you want them talking to the general public, and you want them to be proactively doing this. And the WHO, I think, has done a really great job just to try and calm fears because of all of this, the way that people are looking at this. That's why you saw the WHO Director General on the ground there. That's why you see the French president speaking in specifics, because they're trying to calm the public and do this the right way. And I think the CDC could add to that if their experts are allowed to engage with the public the way they have during other public health emergencies.
Doc, I have just 2 quick clarifying questions for you because I know our audience is really locked in on this. First, how does this spread? If you could answer that for us, because we know that there are other passengers that are showing symptoms, so it spreadable. That's what we want to know. 2, when we hear about this French passenger that developed the symptoms on the flight, how long does it take for symptoms to show? Because we got these folks going to Nebraska. Maybe they don't think that they're infected, but maybe they go home wherever they live and they are. So could you just clarify those 2 things for our audience?
So hantaviruses in general are rodent to human, but the Andes version can go human to human, and it's usually people who have close contact with each other, people who share beds, who share utensils, who have exposure to each other's body fluids, like saliva, for example. So that's how it spreads. It doesn't spread the way measles does, or COVID, or influenza. The other thing is that the incubation period is long. It could be up to 6 weeks. So people can get sick anytime during that 6-week period. That's why we have monitoring for these individuals. And this French person that was evacuated, we expect to see cases amongst those passengers. It's not run its course. So there will probably be more people who were evacuated off that ship that are going to test positive, but they're going to be isolated and they're going to be treated appropriately in their contacts trace if they have any new contacts. That's the whole point of this whole process. But you shouldn't be alarmed if any of those passengers test positive. That's why we're going through this, to catch them as soon as they test positive.
All right, Dr. Amesh Adalja, thank you so much for joining us tonight, answering all our questions.
Thanks.
All right, Joey, I'm going to go out to you. I'm glad I asked the clarifying ones because I was a little confused. And then I guess I got a little bit more confused because he said that you had to have close contact, share utensils, or bodily fluids. I'm not sure how other passengers on the ship that weren't in the same bed or room transferred it to other passengers unless they were playing, a game of spin the bottle or using each other's forks. So I'm a little confused on that, how other people are getting it. I'm happy to hear that they're not sounding the alarm. I don't think we want anyone to freak out or panic, but I still have a couple questions in regards to these people that can voluntarily leave.
Yeah, I mean, you talk about cruise ships. We do a lot of cruises. There's a lot of ways to. There's pools, there's, public watering fountains, stuff like that. You go in, you cough on your hand, you hit a doorknob, the person behind you comes, hits the doorknob and wipes their face. So I'm not surprised that it has transmitted. I think the fact that there are hundreds, if not 1,000 or more people on that ship, and we're talking about less than a dozen of them that have maybe contracted it, are pretty good numbers. And I tend to believe the doctor there in a sense of we don't need to worry about a pandemic, but it's good to be further educated that there are things out there that can kill you, and it's not a bad idea to wash your hands and practice good hygiene, and maybe don't go watch birds in some, third world dump. I mean, come on now. Common sense goes a long way. And I'm not talking ill of the dead. I mean, we all follow our passions, but we have to be safe if we're going to be around other people, too.
Joey, a couple things I'm not going to do: visit the Obama Library or go to a landfill and watch birds. Molly.
Slightly different things.
Yeah, well, depends
I
on where
say
you are.
that knowing the places I go to duck hunt. So a little bit of hypocrisy going on here. My bad.
Molly, you asked about some of the communication here. I think it's a fair question. Yeah. The American people lost a lot of trust in the CDC and the World Health Organization for a lot of reasons during COVID. We know this is a new CDC. You mentioned maybe there could be a little bit more communication. I think they're probably trying to err on the side of we don't want people to panic because we don't want to do what we did in COVID. But do you think that we need to hear a little more just for the folks out there that might be a little nervous?
Yeah, I mean, I still have a lot of questions, and I think part of it is how the other countries have reacted with so much transparency on the ground, and that the WHO is going there and dramatically thanking Spain in dramatic fashion for allowing the ship to come there, and that planes are going there and repatriating citizens being sent by governments. It feels like, more answers are warranted. It's certainly fair to ask the questions about numbers, how many people are coming back, how long the incubation period is also, where we're talking about something like 42 days. Just today, they put out a health alert, finally. The multi-country Hantavirus cluster linked to the cruise ship 2026, the CDC put this out today. As we've been watching this for, several days a week, it's been a major point of discussion. So I think I'd like to have more information, more transparency.
I mean, some of those organizations that, you're praising they're going out and doing things. I mean, they also lost a crap ton of credibility, and they're probably trying to get some of it back. And I think that when you look at the CDC and the folks that are leading our government and leading it now, they're probably trying to be more deliberate than maybe we were 5 or 6 years ago.
Which isn't a bad idea. What do you think, Guy, of what the doc shared with us?
Well, a couple of things. I'm glad that you did ask those clarifying questions, and he did give some pretty specific answers. Like the 6 weeks of incubation was interesting to me because that suggests that there will be more confirmed cases from this population of people in the coming weeks, and we should not freak out about that because it's expected. He said the disease is behaving as projected. Yeah. That is reassuring to me. And then to my question was about Dr. Bhattacharya, who said that in the past the containment measures had worked well. And when I asked about that, he gave, again, with specificity an answer about a birthday party in Argentina and one individual in Delaware, and they were able to clamp down on both of those and not see a wider outbreak. Those were reassuring answers, at least in my book.
Yeah.
All right.
Be sure to like and subscribe for all the Fox News latest on YouTube and catch full shows streaming now on Fox One.